Hello, everyone. My name's Robin Hansberger, and I appreciate you joining us today for our presentation of the Healthy Aging Brain. As most of you know, Hansberger Physio Plus is all about building a better you. We hope you feel better, live better, perform better, and work better after working with us. Whether you have a new injury, you want to take your game to the next level, or you're just finding it harder to move like you used to, Hansberger Physio Plus can get you to being your best you. We will not only treat your current pain, but we will address the cause and empower you with the right plan for attaining long-term results that you can celebrate. Our difference. Personal empowerment is key to living a healthy life. We believe a whole body approach is key to injury prevention and recovery. Personal empowerment helps to achieve long-term results, and with the right plan, you will live a healthy life. Hansberger Physio Plus does a lot of things for a lot of different people, but everything we do is centered around a proper biomechanical evaluation. Whether that's visiting us for physiotherapy, registered massage therapy, athletic therapy, osteopathy, you're looking to focus on injury recovery, or most importantly, injury prevention. Perhaps you've been involved in a motor vehicle accident or a workplace injury. You've sustained a concussion, or you're looking for a cognitive assessment like the Healthy Aging Brain. We also focus on sports performance, sports vision training, workplace programs and corporate wellness, fitness and personal training, foot care, orthotics, and compression therapy. As you can see, we do a lot of things for a lot of different people. What I'm most excited about today is to introduce you to Effin Gonsalves. He's a registered physiotherapist, a retired athletic therapist, and he's our managing clinical director in our Markham clinic. Effin's been a fixture at Hansberger Physio Plus for 20 years. And we really appreciate having him on the team. Effin's special interest areas include concussion management, healthy and aging brain, and sports performance training. In particular, he's very interested in how the brain works in both a healthy and injured state, and how healthy lifestyles and prevention strategies can keep our most important body part functioning at its optimal level. And that's really what spurred on our presentation today. Everything we do is centered around a client's better moment. And today, we hope that your better moment is a long and healthy cognitive life. Without further ado, I would like to pass things over to Effin to begin our presentation on the Healthy Aging Brain. Over to you, Effin.
Thanks for the warm introduction, Robin. I am super excited to talk about this topic. It's something I've been looking at for quite a while, and excited to talk more about it. And I think back to when I was in my teens, I used to wonder what would be worse later in life, losing one's physical or mental abilities. I know, sounds like a morbid topic, but at the time, it kind of made sense. But now that I'm older, I've come to realize that losing my mental abilities is a much more scary outcome than physical. So for today's presentation, there are several things that we want to talk about. So at the beginning, we'll go through a little bit more of an introduction as to what is dementia, what is Alzheimer's, sort of define some of those terms, talking about what is cognitive superager is, a discussion about why us at Hansberger Physiotherapy, why are we talking about the aging brain, and then go into some more details about what the normal aging brain looks like, what a dysfunctional aging brain also looks like, and then our approach to dealing with the healthy aging brain, and then lastly to talk about sort of some more general next steps to maintaining that healthy brain. So to start with, cognition is a combination of processes in the brain that are involved in almost every aspect of life. They include thinking, memory, language, judgment, and the ability to learn new things. In general, a problem with cognition is called cognitive impairment, and there are several different types. There are many causes of cognitive impairment. They can include the side effects of medications, blood vessel disorders, depression, dementia. In general, 10% of people over the age of 65 live with some form of mild cognitive impairment. And 65% of these people go on to develop some form of dementia. Here are some more numbers to look at. Today in Canada, there are over 500,000 Canadians living with dementia. By 2030, that number is expected to rise to almost 1 million people. Currently, every year, 76,000 Canadians are diagnosed with dementia. And 65% of those diagnosed with dementia that are over age of 65 are women. 1 in 5 Canadians have experienced caring with someone living with dementia. You might ask, why is dementia more common for women versus men? One of the thoughts has been that women tend to live longer, so a greater chance of dementia developing. In addition, the idea about estrogen potentially having a protective effect, and also too, in a lot of cases, most caregivers are women, which increases stress, mental and physical on them as well too, which might also increase the risk. Looking at some of the costs, it costs over $10 billion to deal with dementia in terms of the Canadian economy and the healthcare system. For example, almost $400 million is what's required to bring a dementia treating drug from the lab to the market. And unfortunately, at the moment, there aren't any medications that actually help cure dementia. There is a stigma that goes with that as well too. A study showed that 50% of Canadians are concerned about being affected by Alzheimer's. 46% of Canadians admit they would feel ashamed or embarrassed if they had Alzheimer's or dementia. And 87% of caregivers wish that more people understood the realities of caring for someone with dementia. Throughout this presentation, there are a bunch of definitions, a bunch of terms that I will be throwing around, so now is probably a good time to actually go through some of these definitions. Dementia is the first one, and dementia is not a specific disease, but rather is a general term for the impaired ability to remember, to think, or make decisions that interferes with doing everyday activities. Although dementia mostly affects older adults, it is not a normal part of aging. Alzheimer's disease is another term, and it's the most common cause of dementia, accounting for up to 80% of cases. It actually is caused by specific structural changes in the brain, such as amyloid plaques that lead to damage. The trademark symptom with Alzheimer's is trouble remembering recent events, such as conversations that occurred, in the last few minutes or the last hour or so, whereas difficulty remembering distant events occurs much later in the disease. We have a family friend who in his 70s developed Alzheimer's, and interesting with him is he was a concert musician. He actually played the cello, and as his disease progressed, it was amazing how when he would put the cello and start playing with it, he could play music that he had played for most of his adult life, even without having to look at sheets of music, and he could figure that out. Where it was more challenging is if it was a new piece, he struggled with that. But pieces he had played, in a sense, dozens or hundreds of times just came naturally and flowed beautifully. And it was amazing to see just how much of a challenge Alzheimer's could be in his everyday life, but something like music, it had very little impact in terms of the day-to-day challenges for him. A few more definitions for you. Age-associated memory impairment is when there's no underlying medical condition causing memory loss other than age-related changes. So that's a common one, and that's something that affects most people. Mild cognitive impairment is sort of the in-between thing. It basically lies in between general age-related changes and dementia. And as the name suggests, the symptoms are mild. You experience memory loss and other symptoms such as difficulty speaking and disorientation, but they're not so severe that they interfere with your normal daily functions and routines. This is also referred to as cognitive decline. So let's talk about what a cognitive superager is. And honestly, as I was putting together this presentation, this was sort of let's call it a role model for how we should all try to be, what our goal would be as we get older, to have sort of this super ability. And basically a cognitive superager is, in the truest sense, somebody over 80 that when they do performance tests for memory, for concentration, their results are basically comparable with people that are 20 to 30 years younger. They've also been doing similar tests with younger cohorts, for example, in their 70s or 60s, and seeing some of the same patterns, but the true definition is those that are over 80. So pretty awesome to think of, having that old age, but still having the ability to, in a sense, blow younger people away when it comes to cognitive tests. So some of the hallmarks that sort of define a superager is, one, they seem to have a brain that defies wear and tear better than the average brain. Just seems to be more resilient. It can handle more stresses. Part of that could be that the brain is more dense, with a larger number of brain cells than average. The brain seems to shrink at a much slower rate, actually 50% of the normal rate. And on top of that, it seems like that the changes that take place, especially with diseases like Alzheimer's, the tau degeneration, the tau tangles, the structural changes, it seems to be better resistant against that. And on top of it, there seems to be an enhanced sort of psychological well-being. So as I said, this is the focus of our program, to identify where you stand and to help give you the tools to achieve your optimal brain health, your goal of trying to be a cognitive superager. So some good news. First is that dementia and mild cognitive impairment are relatively rare. Most older people don't develop dementia. And the current estimates is that fewer than 1 in 5 people over the age of 80 have dementia. The second, and this is probably more important, is that it's possible to reduce the risk of cognitive decline. Recent research shows that our genes are responsible for approximately a quarter of the variability in cognitive abilities as we age, which means that 3/4 of the influence over our aging is potentially modifiable factors, such as lifestyle factors that we can control, such as diet and exercise. Yes, I know, it's that term, diet and exercise again, and it's amazing how much those two components seem to come in for so many different things when we look at our health. So change gears a little bit, is why are we at Hansberger Physio Plus talking about the healthy aging brain, or the brain in general? And our rationale is that, health and wellness take on a holistic approach, where for us at Hansberger Physio, we look at the full body in terms of both injury prevention and injury care. And many of the interventions that we use incorporate things like meditation, mindfulness, things that go beyond the traditional physical components. Furthermore, our expertise and reputation in concussion management, as well as sports vision training, opens this door to another form of cognitive health. So using our validated cognitive assessment tools and our own sort of assessment protocols as leading components, our goal was to create sort of a one-of-a-kind, very unique, but very in-depth cognitive evaluation experience. So we've been a leader in the concussion field for over 20 years, long before it became an in thing. Our team has experienced working with concussion injuries from the moment they happen at sporting events all the way through to full recovery. Along the way, we've layered in other approaches to address the brain by training decision-making, reaction time, concentration, and memory, all areas that, as we talked about, can decline as we age. Working with the aging brain is another step in this continuing, as many of the challenges presented are very similar to issues after a concussion. So further in our presentation, we're going to talk a little bit more about what the normal aging brain looks like. The average adult brain is about the size of a medium cauliflower. It consists of an intricate system of nerve cells, referred to as neurons, and supporting cells, and a very large network of blood vessels. At only 2% of the body's total weight, the brain receives 20% of the blood supply and uses 20% of the total caloric intake. So it is definitely a powerhouse that requires a lot of nutrition, a lot of blood, to basically keep it running, since it's such an important thing in our everyday life. In particular, to be able to function well, it is essential that the brain receives an excellent blood circulation. Neurons generate and carry electrical signals which provide information to and from our muscles, our glands, our sensory organs such as our skin, eyes, ears, and via the spinal cord. Inside the brain itself, there are approximately 100 billion neurons. Each neuron makes an average of 1,000 connections to other cells in the brain, producing around 100 trillion connections in the brain. Pretty amazing network and system. When we look at how the brain functions, there are sort of three main areas. There are automatic functions. And that includes things like breathing, heart rate, digestion, body temperature control, things that sort of happen automatically. Secondly are our motor functions, and that's our balance, our coordination, our movement, posture, speech, and mainly that has to do with our muscular system. The third area are cognitive functions. So that's sort of our thinking, our concentration, thoughts and emotions, how we coordinate sounds, smells, as well as learning. Cognitive function is commonly believed to decline in older age. However, age-related declines in mental abilities are highly variable between different people, and average declines may be seen across populations. Cognitive skills that are more likely to endure with age include vocabulary, information, and comprehension. Whereas the flip side, capacities that decline include memory, such as ability to hold phone numbers in our mind, known as working memory, processing speed, and executive functions, such as planning, organization, managing time. These declines can begin in middle age or even earlier. One thing to keep in mind is that age-related changes in the brain are normal. It's scary to think this, but many thinking abilities peak at the age of 30 and then subtly decline as age increases. Some normal changes include slowness in thinking, difficulty sustaining attention, difficulties with multitasking, holding information in mind, and word finding. Normal age-related declines are subtle and mostly affect speed of thinking and attention control. Almost 40% of people over the age of 65 experience some form of memory loss. Age-associated memory impairment is part of the natural process of aging. For most people, memory generally remains strong as they get older and doesn't decline rapidly or substantially. It's quite normal to not remember, for example, where you left your keys. The reality is you probably didn't even pay attention to where you left them in the first place. Hence, it's not really a memory issue. Most people would systematically think through where they might have left them. In your pants, your purse, the coat pocket. Go through step by step where you last had them and then figure out where they might be. And soon enough, you'd have them. The concern is not being able to logically work through this process, or alternately finding them in a nonsensical place, such as the freezer. So then that sort of leads us to think more about the dysfunctional brain. But the reality is, if you're experiencing difficulties with memory, but they're not disrupting your everyday life, they're not affecting your ability to complete tasks, you have no difficulty learning or remembering new things, and there's no underlying medical condition that's causing you memory problems, then this would be really sort of that normal age-associated memory impairment. And that is a normal part of aging. It doesn't mean you have dementia. But if you don't remember where you left your keys and you find them in the freezer, then we need to start talking more about the dysfunctional brain. So mild cognitive impairment affects between 5 and 20% of the population age 65 or older. It affects cognitive function to a greater extent than would be expected, but not to such an extent that it precludes independent living. Some cases of mild cognitive impairment are treatable. 1 in 6 progress to dementia within a year. Dementia encompasses different types of diseases which causes different types of damage to the brain, and so far dementia is untreatable. As mentioned earlier, the most common type of dementia is Alzheimer's disease. The next is vascular dementia, which is up to 30% of cases. But we do know, and that's the positive part, is that up to 40% of dementia cases can be prevented or delayed. Dementia is a set of behaviors or symptoms which suggest difficulties with cognitive function. The most common symptoms include memory loss, confusion, mood and personality changes, as well as problems with planning and doing tasks in the right order. It's diagnosed when the symptoms cause such problems with everyday tasks of daily life that the person affected cannot carry on living independently without care any longer. It's an organic disorder, meaning that there is an associated physical deterioration of the brain tissue, which can be seen via brain scan or after death, such as an autopsy. It's progressive. The damage and symptoms get worse over time, and is therefore not a result of normal aging, but rather the result of a disease. It is likely the damage to the brain starts decades before the real-world symptoms begin to show. This very long latent period has made a cure for dementia very difficult to develop, since deterioration has progressed so far by the time the symptoms are apparent. It also makes the identification of risk factors and protective factors via observation studies more difficult as well. So next, I'm going to talk about the Hansberger Healthy Brain Program. We're very excited to be offering the Healthy Aging Brain Program, which is a comprehensive cognitive assessment. Our expertise and reputation in concussion management for the past 20 years, as well as sports vision training, opens the door to this new form of cognitive health. We've teamed up with Cambridge Brain Sciences using a validated cognitive assessment tool and our own neurocognitive assessment protocol as leading components to provide a one-of-a-kind cognitive evaluation experience. Many people who are developing dementia or already have it do not receive a diagnosis. A study showed that physicians were unaware of cognitive impairment in more than 40% of their cognitively impaired patients, which may be even worse now during COVID, with so few people having been seen in person over the last couple of years. The problem of underdiagnosis is even more pronounced in underserved population and in those areas with lower educational attainment. Another study found that more than half of patients with dementia had not received a clinical cognitive evaluation by their physician. The failure to evaluate memory or cognitive complaints is likely to hinder treatments of underlying disease and comorbid conditions, and may present safety issues for the patient and others. In many cases, the cognitive problem will worsen over time. One of the benefits of early detection when it comes to looking at the healthy brain is being able to ensure patients receive the most benefit at the earliest point possible for treatment options. It also gives you more time to plan for the future. Some lessened anxieties about unknown problems, increased chances of participating in clinical drug trials helping advance research, an opportunity to participate in decisions about care, living options, financial and legal matters, time to develop relationships with doctors and care partners, and to benefit from care and support services. For most people, a cognitive assessment is triggered by your family doctor after hearing your worries over memory issues and other cognitive concerns. One of the most common tests used is the Montreal Cognitive Assessment Exam. You might be familiar with it, as this was Donald Trump's intelligence test that he proudly boasted about how well he performed. The reality is that everyone does well on it, unless there are significant cognitive issues. Depending on the severity of concerns, other health issues or family history, a neurologist or neuropsychologist may also be involved. So in terms of our program, we have some goals for our clients: to provide a detailed cognitive evaluation of the aging healthy brain, annual or semi-annual reevaluations to monitor changes in your cognitive status, identifying lifestyle factors that may identify an individual at risk for cognitive decline, create an intervention plan to assist in maintaining a healthy brain, and referral back to the family doctor for alternate evaluations for those at risk. So I'm going to spend some time now talking more specifically about our Healthy Brain program and the different components. So first component is lifestyle. Basically, it's an idea of what you've been. Substantial evidence suggests that certain lifestyle behaviors, such as smoking, sedentary lifestyle, and poor dietary choices, predict faster cognitive declines and a higher risk of dementia, while physical, mental, and social leisure activities are found to be protective. A term that's often thrown around is cognitive reserve, and that refers to how flexibly and efficient a person is to use this available brain reserve, which is based on the size of your brain, the number of neurons, to basically handle any deficits, any challenges to the cognitive system. Early life seems to be the most critical for the development of this cognitive reserve, such as learning and education, whereas other sort of outside factors, such as poor childhood social circumstances, seem to contribute to the risk of adult disease or later life risk of dementia. Lifestyle behaviors, including those that influence cardiovascular and metabolic risk, become more influential in midlife, although some, such as diet and physical activity, track back into childhood, while mental and physical activity patterns continue to moderate these risks later in life. Exercise is one of the strongest protective lifestyle factors, whereas smoking has the biggest negative effect on cognitive health. The fact that lifestyle behaviors are modifiable, remember what I talked about, 3/4 of our cognitive risk comes from our lifestyle, implies that encouraging a healthy lifestyle may prevent or ameliorate cognitive declines in underlying cerebrovascular and cardiovascular risk factors. Second component is neurocognitive testing. Neurocognitive testing is a way to measure brain function non-invasively. It uses tests to assess important aspects of cognition, such as attention, memory, language, reaction time, and perception. The different tests are specifically crafted to measure particular aspects of brain functioning. By measuring these subtle aspects of the function, researchers and clinicians can get a powerful microscope into what's happening under the hood, so to speak. In this way, neurocognitive testing gives a standardized way to get a snapshot of brain health. The tests are objective, and the scores give a way to compare a person's function to the rest of the population or against themselves over time. Neurocognitive testing can help detect problems early on. Early detection of concussion and dementia are commonly missed, but they don't have to be, because they are accompanied by subtle changes in attention, perception, and hand-eye skills. Those changes can be picked up with simple tests, and that can help determine someone's fitness for returning to work or athletic play, or their capacity for living alone and managing their own finances. Neurocognitive testing can tease out the pattern that allow detection and can also allow tracking through time. For example, to keep a good baseline of your cognition in mild cognitive dementia or to assess recovery in concussion. Our program uses a suite of testing components that we also use as part of our concussion program and sports vision programs. In addition, we are using an evaluation system created by Cambridge Brain Sciences. CBS Health is an online brain health assessment service that accurately measures core elements of your cognitive function, including memory, attention, reasoning, and verbal abilities. Hansberger Physio Plus will use these measures to assess, monitor, and manage core areas of cognition that are key to your mental health and wellness. CBS Health allows you to quantify the core elements of cognition and track your cognitive trends over time, validating that treatment or wellness plans are having the desired effect or allowing you to detect episodic changes to your cognition. Another area is balance. Cognitive function and balance remarkably decline with advancing age, which often restricts participation in activities of daily living and may contribute to secondary health risks such as falls in the elderly. All aspects of balance control have been found to deteriorate with increasing severity of cognitive impairment, and that executive function plays an important role in balance control. This decrease in balance occurs to a greater degree when multiple tasks are involved at the same time. Our autonomic nervous system is also quite important in terms of a healthy brain. Assessing the autonomic nervous system to determine overall health status, ability to heal, and recover. The autonomic system is part of our nervous system and is made up of two components, the sympathetic and the parasympathetic. These are often referred to as the fight and flight or the rest and digest systems. The human body ideally wants to spend most of its time in the rest and digest state, but still needs to be able to quickly adapt based on changing conditions. Activation of the autonomic nervous system has been reported to occur during cognitive testing involving abilities such as attention, memory, and executive function. Higher parasympathetic activity at rest has been associated with better performance on memory, conflict resolution, general intelligence, attention, and executive function tasks. In contrast, lower levels of resting parasympathetic function have been related to poorer attention, executive function tasks during both stressful and non-stressful situations. In general, the parasympathetic nervous system has been associated with healthy cognitive aging, whereas excessive sympathetic nervous system activity has been linked to heightened cognitive decline. Another topic is cortisol and free radicals. When our body is put under stress, it goes into a fight or flight response, as I mentioned earlier, that is facilitated by the release of the body's stress hormone cortisol. When the stressful situation passes, cortisol levels drop and return to normal resting levels. If our body is under chronic stress, our fight and flight response stays turned on and cortisol levels in our body remain at an elevated level. This can lead to several adverse health effects, including altered mood, anxiety, depression, along with memory and concentration impairment. Elevated cortisol is associated with poor overall cognitive functioning, as well as with poor episodic memory, executive function, language, spatial memory, processing speed, and social cognition. Throughout our daily lives, our body produces free radicals through oxidation. If we produce too many free radicals, which can occur from overtraining, injury, inflammation, or stress, or if we lack the antioxidants to get rid of the excess free radicals in our body, it's at a risk of oxidative stress. This oxidative stress can lead to a number of diseases, including heart disease, diabetes, certain cancer, and neurocognitive disorders. It's been found that oxidative stress is a common denominator in the pathology of neurodegenerative disorders such as Alzheimer's disease, Parkinson's, Huntington's, amyotrophic lateral sclerosis, and multiple sclerosis, as well as ischemic and traumatic brain injury. Next, we'll talk a little bit more about vision. Contrast sensitivity is your ability to distinguish the foreground from the background. A contrast sensitivity test measures your ability to distinguish between finer and finer increments of light versus dark contrast. This differs from common visual acuity testing, such as the routine eye exam, which measures your ability to recognize smaller and smaller letters on a standard eye chart, and giving you a score such as 20/20 vision. Contrast sensitivity is a very important element to measure in terms of visual function, especially in situations of low light, such as fog or glare, when the contrast between objects in their background is often reduced. Driving at night is an example of an activity that requires good contrast sensitivity for safety. This contrast sensitivity declines with age and with health conditions such as cataracts and diabetic retinopathy. Poor performance has been associated with a person requiring a low vision assessment and disease such as macular degeneration or glaucoma. This impaired contrast sensitivity is associated with declines across more cognitive domains than other measures of visual functioning, suggesting that impaired contrast sensitivity may be associated with a greater cognitive decline than visual acuity alone, which is more commonly measured. So shifting gears, now I want to talk a little bit more about some of the next steps for you to follow for a healthy brain. Number one, look at getting a comprehensive healthy aging brain assessment. Exercise regularly. As I mentioned, exercise seems to be one of the most important things for a whole variety of health issues and good health, be it our mental health, our physical health, our heart, our mind, our ability to handle stress. Exercise is such an important component. Making strong social connections are key. It's a big area when it comes to cognitive health. Having those strong links to people, friends, family, the more connected we are, the better it is. And from a COVID perspective, things are a little bit more challenged with that, but the more we can keep those connections strong, the more important it is. Eating a healthy mind diet, one that is low in sodium, that follows more of the Mediterranean type of diet, seems to be one of the best ways to keep your brain healthy. And like exercise, healthy eating is also a major component for a lot of lifestyle changes and a lot of positive lifestyle issues. A rule of thumb is if it's good for your heart, it's good for your brain. Use curiosity and learn new things. The fact that you're listening to this presentation is something about learning something new. The more you can challenge your brain to learn something new goes a long way for long-term brain health. And lastly, you want to protect your brain from injury. Wearing helmets when you're doing activities such as cycling, skiing are important. There is a link to having multiple brain injuries, especially more significant than concussion injuries, and greater risk of other cognitive problems down the road. And it's something that, the better you can keep your brain healthy and safe, the better it is for your long-term health. So in summary, some memory loss is normal with aging. Cognitive decline in Canada is expected to double in the next 10 years. A lifestyle management can significantly adjust your risk of cognitive decline. The better you do with it, the greater your chance of having good cognitive health. Although there are no known cures at present, early detection may offer a greater chance of positive interventions, whether it be they have a chance to be more effective before some of the structural changes have taken place, or just a greater chance to make those lifestyle changes as well too. And then comprehensive testing can be demonstrated where these changes can be made. The more you understand about the things you're doing well, and the flip side is the things you're not doing well, the better you are at being able to make those changes to have that positive brain health and to be a cognitive super ager, as we all strive to be. We appreciate your time in listening to this presentation. And if you have any more questions, you can reach out to me at Efan, E-F-A-N, at hansbergerphysio.com for more information, or to book your assessment so we can talk further about how we can help you in terms of your long-term brain health. Thank you.